Good morning, everybody. My name is Prad Sekar, CEO and co-founder of Skylight Health. And thank you for joining me on today's update as I bring to you some context behind our latest press release from this morning about the partnership with the new direct contracting entity for our traditional Medicare patients beginning January 2022. As a quick recap, Skylight Health is a healthcare services and technology company. We operate primary care practices in the US. We benefit from the growth through acquisition of independent primary care practices, where we help these practices long-term shift from volume to value. And in value, these practices obviously can create more benefit for their patients through additional services, through additional funding, all received from payers and the healthcare government, who look to reimburse primary care physicians for providing a higher quality of care and a higher cost of care under the Skylight Health platform. The direct contracting entity is a very exciting step forward for Skylight. It is a significant evolution and growth from the ACO that we announced a few months ago. The direct contracting entity, first of all, is the newest initiative from CMS for traditional Medicare patients to contract under value-based care arrangements directly with CMS. The direct contracting entity allows for a total cost of care, which means full risk models once practices demonstrate their capabilities, which means that similar to what you will see in Medicare Advantage, what you did not see previously in the Medicare Shared Savings Program, you will now see under the DCE, which means that Skylight and its patients, as we continue to grow each year, will benefit from those increased rewards by way of taking on more risk with these patients under the direct contracting model. Second to the direct contracting, of course, is the alignment we have made now with the direct contracting entity owner, which in this case happens to be one of the top Fortune 50 healthcare organizations in the United States. Now, this comes in the back of several conversations we've been having with this payer organization, and conversations that we continue to believe will lead to more opportunities across other types of value-based care arrangements. But today starts with the direct contracting vehicle for the traditional Medicare patients. The payer organization brings a tremendous amount of infrastructure, support, and organization, which will help Skylight in really accelerating its journey to full risk. And we can really look forward to expecting seeing how this relationship evolves with more time. And of course, from Skylight's perspective, it really does cement us with one of the top organizations in the US today with significant amount of experience, patient lives, and demonstrated quality measure outcomes and cost savings in the US healthcare system. We're very excited for where this organization is looking to grow. These types of partnerships really bring us a lot more clout, bring us a lot more credibility, but also allow us to establish a payer partner that we can look to move into more markets with, that we can look to create more opportunities with, and of course, allow us the conversation and continue to let Skylight Health be at the table with other types of payer organizations and build more types of value-based care arrangements in the future. We are very busy here at Skylight, continuing to look for more acquisitions. Our pipeline continues to remain robust. We certainly look forward to having more deal flow in the short term, which will continue to, again, accumulate more patient lives that will contribute into the value-based care arrangements that we have. Ultimately, it's about making the patient health experience better, and these types of programs provide more funding to Skylight to be in control of where that dollar goes, which means that we can create more funding for patients on their specific needs. And again, it is a program by which if patients remain healthier, the healthcare system sees lower costs, and organizations like Skylight continue to benefit in bringing those improvements to the health system. So again, very excited about today's news announcement. I'll also take this minute to touch on some of the questions I've received on our latest filing of the base shelf prospectus. So for those of you who may not be aware, we already had a base shelf prospectus filed as part of the listing process on the NASDAQ. This is the exact same base shelf, so there's been no new shelf filed in addition to that. The only difference is we have now created an opportunity for this shelf to allow for alternative forms of financings to be considered as part of the shelf, not just equity. As you may know, we're working on a number of conversations where we're looking at various forms of capital to be used in acquisitions, and we're always mindful of cost of capital and making sure that we can take the best cost at the right time that allows us as an organization to put that money to growth, to be able to acquire more practices, to be able to rapidly expand our business in the United States, and long-term see these patients benefit under a more risk but higher reward value-based care arrangement. So with that, thank you all for listening. If you have any questions, you can always email us at investors@skylighthealthgroup.com. But otherwise, I'll be on here shortly on our next announcement. Thank you.